Okay. Welcome all of you. This is Nema Ahmed Al-Fakir, Research Assistant at Mycetoma Research Center in the Microbiology Department. It's my pleasure to be here at Mycetoma Research Club. And thank you, Professor, for giving me this opportunity. Let's go about through our presentation. Our presentation today is about the mycetoma microbiological diagnosis and culturing technique. Let's begin with a brief introduction about mycetoma. The mycetoma is a chronic implantation mycosis that characterized by large villous subcutaneous swelling with the formation of sinuses that can discharge grain. The most frequently located areas is the hand and foot, but it may affect head and neck and other body part. It can cause lifelong disabilities that can considered as a social stigma. Primary mycetoma result from inoculation of the causative pathogen into subcutaneous tissue, and it's classified into actinomycetoma, in which the causative agent is bacteria, and eomycetoma, in which the causative agent is fungi. The most common causative organism for actinomycetoma is Actinomajura. First, we have Actinomajura species, in which the most common subspecies is Actinomajura majuri and Actinomajura belterii. And also we have Nocardia brasiliensis in Brazil and Streptomyces somaliensis in Somalia. And this type of mycetoma characterized by formation of white, red, and yellow grains. Also, we have the second type of mycetoma is eomycetoma. The most predominant causative agent in Sudan is Margarella mycetomatus. And this type of mycetoma characterized by formation of black grains and in some cases pale grains. Also, we have trematospheric disease, Schistosporium, Acreminium, and Fusarium species. Let's begin our process. The process beginning with sample collection and preparation. First, we collect the grain. The grain collected during the deep surgical biopsy, and you must make sure that to avoid the grains from the open sinus discharge that may be dead or infected, and that may be the main cause of contamination. The grain placed in a sterile container filled with 10% normal saline, make sure that it's labeled with patient identification and date of collection, patient name and age, and date of sample collections. After that, the grains washed with 10% normal saline until it's appearing clear without any tissue debris. Eomycetoma grains usually appear as granules or aggregates with a chalky consistency, and the color ranging from brown to black. In case of actinomycetoma, it's ranging from yellow to red. Behalf of that, we must be very careful during the sample washing, because the grains is very tiny, and we do not want to lose it. This picture shows the deep surgical biopsy process using local anesthesia. Always during this process, we take two type of samples: tissue for histopathological diagnosis and grains for microbiological diagnosis. we can see is in this picture, the tissue is taken from deep tissue. Also, we have the grains. After that, we make sure we have a good documentation system or good documentation for the sample. The documentation involves the patient identification and type of samples taken from the patient and number of samples. In some cases, we take just grains. In some cases, we take just tissue. So we need to make a good documentations. This picture shows that the grain is placed in a sterile container labeled S, while the tissue placed in container labeled F, in which the S for normal saline and F for formalin for tissue for histopathological diagnosis. After documentation and surgical biopsy, the sample is referred to microbiology lab for culture. Okay, let's begin with culture media preparation. We have a different culture media for actinomycetes and eomycetes. For actinomycetes, we use blood agar and yeast extract agar, in which it supports the growth of bacteria, and Lewontin-Johnson media, in which also supports the growth of bacteria. But the most commonly used in our lab is yeast extract agar for the primary culture, and also we use the blood agar and algae media for subculture. For mycetoma, the commonly used media is saprodextrose agar and must be supplemented with 10% gentamicin to inhibit the growth of bacteria that can make contamination. So we can avoid this contamination by adding gentamicin. So in this slide, we have the culture media quality control. For the quality control check, we must leave part of the sterile culture media at room temperature, and part of this sterile culture media at 37 incubator for 3 days. And wait if there is any growth of contaminant, we must withdraw this media, and it is not we're not able to make culture in it. Also, we need to employ the suitable positive and negative control to verify the absence of contamination in growth media and also equipment. Okay, let's go through the culturing technique. In culture, we use sterile loop, microbiological loop or searing to inoculate the grains into media at the center of the universal tube. We always use searing because the chalky consistency and the tiny grains. The loop, it's not suitable for this process. We always use searing, the tip of searing, to take the grain and put it in the center of the universal tube, and we duplicate the culture to make sure that we have a backup of the culture, and also to make sure if we lost one, we have another backup. In the absence of grain, if we do not have grain, the biopsy is fragmented and washed, and then inoculated into the universal tube as a section or as a fragment, so we can get the growth from this. The critical step is labeling of the universal tube with the patient identification and date of inoculation to know that how this culture take and the time of the culture taken to be growth. Document the specimen identification and date of inoculation in documentation log. incubate the culture train at 37 to 25 degrees centigrade. At MRC lab, we have we have separate incubators, 25 degrees centigrade incubator and 37 degrees centigrade incubator for 7 to 10 days for both actino and EO. And we must daily observe for growth. Okay, this picture shows the culturing technique. Firstly, we must sterile our area, our culturing area, using alcoholic disinfectant and also using Colorex to make sure that there is no contaminant in the area. Also, we need to wear personal protective equipment, face mask, goggles, and also sterile gloves. Then the culture is incubated at 37 degrees centigrade incubator, as shown in this picture. Okay, let's go to macroscopical and microscopic examination. For actinomycetoma, upon positive growth was observed, macroscopic identification of colonial morphology must be done. The colony of actinomycetoma have irregular shape, and it's ranged in color from white to red. In the microscopical examination, we use gram stain and modified the Nelson stain. We can find the SOPs for this stain at Mycetoma MRC website. And for eomycetoma, we examine it microscopically. First, microscopically before the culture, using KOH or potassium hydroxide. Then we can make sure we have a fungal structure. And then after growth, we check for the colony, for the color of the colony, texture, and growth pattern. The color of the colony in case of eomycetes in eomycetoma is ranged from black to white. In microscopical examination, we use lactophenol cotton blue to visualize the HIV and spore and fungal cell and conidia. You can find the lactophenol cotton blue stain is obese at Mycetoma Research Center website. Okay, as shown in this picture, we have the observation of the growth. Then this direct microscopy. Okay, let's move to gram stain of actinomycetoma isolate. Actinomycetoma is characterized by branched filaments in which it is mimicking bacteria in which like bacilli, and is mimicking fungi in which like fungal HIV. Here we have the growth in algae media and the stained slides of actinomycetoma. Here we have the growth of eomycetoma isolate, and we have two pictures. In two pictures, we have one picture for Madurella mycetomatus, in which it appear like HIV, have highly branched HIV with a dark colored cell. In another picture, it's shown that the clear septated HIV that contain fungal cell. Let's go to subculturing technique. After we make sure that we have a pure culture, we make subculturing technique to make sure we have a good backup of this culture. For actinomycetoma, once colonies are observed, subculture them into fresh media to obtain pure culture for further identification, and also for PCR or for molecular identification. Using a sterile loop or searing, gather multiple pieces of the growth and introduce them to yeast extract agar plate. Also, we use blood agar and Leonistin Janssen media. And you will make sure to wrap the plate well to avoid agar drying because it takes long time. And incubate the tube and plates at 37 degrees centigrade for 3 to 7 days. And regularly monitoring it for the growth. For eomystomas, collected multiple pieces. You collect the multiple pieces using a mycological loop or searing and inculate it to separate dextrose agar plate and slope. Also, we need to make sure that we wrapping the plate well to avoid agar drying and incubate the tube and plate at 37 degrees centigrade for 7 to 10 days and observe for the growth. After we have a culture, we have a pure culture, and we make a subculture from this. We need to preserve this culture for future reference and research purposes. And we, if we have, we need further identifications. We preserve pure culture of isolate in cryotube filled with 10% glycerol in appropriate storage condition. In this case, the condition is minus 80 degrees centigrade refrigerator. For actinomycetes, isolate, the cryotube is filled with peptone water because it's preserve bacterial structure and bacterial cell well. So the culture and grain stored at minus 80 degrees centigrade refrigerator for research and shipment purposes. So we can also find these SOPs at MRC website. And thank you. We make culture and we have pure culture and we make subculture and there is no contamination, and now we are very happy. Thank you. Thank you. And if anyone have a question, I'm ready.
Thank you so much, Nerno. Thank you. Prof, would you like to comment?
Thank you very much, Neema, for this nice presentation and the detailed information about the culture of the grains for the diagnosis of mycetoma. Now, the floor is open for discussion on letters.
Thank you, Neema, for this presentation, and thank you, Professor Fahal, for the opportunity to have some comments about the presentation. I have a few comments regarding the culture technique. Usually for mycetoma, it's always advised to use separate dextrose agar.
Yeah.
Separate dextrose agar is a rich media, and it's not expensive, and it's available everywhere. And when it comes to actinomycetes, yes, sometimes we need to inoculate the primary grains in blood agar first. Then very quickly we need to make a subculture in a rich media, which can be also separate dextrose agar. Separate dextrose agar might not support the primary isolation, but for the subculture, it's quite good media.
Now,
Your advice is to avoid using LJ media, because LJ media actually is not designed for actinomycetes. It's originally designed for Mycobacterium tuberculosis, causative agents, and it's have a different commercial versions. And most of these versions contain antibiotics. And antibiotics will inhibit actinomycetes, by the way, and also contain malachite green, which also inhibit gram-negative bacteria. And most of the actinomycetes are gram-positive, so it will be inhibited by the penicillin, which always found in commercial versions of LJ media, unless you use and you prepare a homemade LJ media and you know exactly what is the selective agents in the medium. And the problem is also we have also other selective agents, which include cyclohexamide in some commercially available LJ media, and this sometimes might inhibit the pale grain causative agent. Sometimes we are dealing with fungus, and we saw that it's actinomycete. We use LJ media, and once you inoculate it in this type of commercially available LJ media which contains cyclohexamide, it will inhibit also the fungus, and we are going to miss the isolation. Thank you very much.
Thank you, Dr. Abdullah. If there is any other question, if you want to ask, you can just unmute yourselves. Yes, Prof.
Dr. Abdullah, what do you think about the technique itself? Is it useful? Is it still the golden standard procedure to identify the organism? Or what do you think about it?
I think
Especially
especially
in mycetoma endemic areas where nothing is there apart of this culture and histological diagnosis.
I think culture remains the gold standard for identification of the causative agent, but it needs a skilled laboratory technologist, and it also requires a viable grains, which sometimes is not available. And I think the very simple technique we can use in any diagnostic lab, in any microbiology, or even in a general lab, is the direct examination of the grains under the microscope. Because once you have a grain, you are going to answer a very basic question, that whether this grain is a fungal grain or a bacterial grain, which is quite useful and very enough for the clinician to start the medical treatment. So if you have a grain and you crush these grains under the slide and you examine it using lactophenol cotton blue or just simply gram stain, you can identify the bacterial filaments or the fungal hyphae. This is the first step. So I will consider that the very basic thing is to make a direct microscopical examination of the grains. But for doing research, you definitely need to have an isolate. This is why we go for culture. And even if we have facilities for PCR, we are going to confirm that this might be a fungal mycetoma or a bacterial mycetoma. We are going to miss the isolate itself, which is very useful for the subsequent research work. We need to have a blue culture. We need to get a good quality DNA for sequencing and for other, even for like biological testing of many compound. We need to have the isolate. So we always need to culture. We always need to preserve the cultures. And they have also comments about the stock culture, how we can stock the culture and keep it in the lab. If we are dealing with bacterial actinomycetes, in this case, we can use, as Neema mentioned, we can use the glycerol bros, and we can keep it at -80 freezers. But for the fungal causes, the best way is to look into the fungus itself. If it's a sporulating fungus, the best way is to do a localization of the fungal culture for very long-term storage. And the other way, if it's not sporulating like Madrella mystomatis and most of the mycetoma causative agent, which does not produce a large amount of spores, the best way is to preserve the culture under paraffin oil, sterile paraffin oil, and keep it at room temperature at dark. This is far better than using the -80 because the -80 might kill the fungus. Thank you. Okay, if we don't have any more questions.
Hello?
Yes, we are here, you, bro.
Thank you, Abdullah. Thank you very much for this elaborative talk about the technique itself. As you mentioned that this test should be The standard test for quite a long time, especially in mycetoma endemic areas, where it is for other diagnostic tools like the molecular diagnosis. As you mentioned, it's a simple procedure, but you need a lot of experience. You need a lab with high standard of sterilization to avoid the contamination of the media and the plates. You need to be patient with the culture. We need to observe the culture media every day and to see the growth and see what's happening there. And again, this is one of the problems with the culture. It takes quite a long time for us to identify the organism. Thank you very much. We have a paper going to be published soon on the culture technique and the advantage and disadvantages, and then and how can we improve the quality of the culture in our labs. Thank you very much.
Well, thank you, Prof. If anyone has a question, you can just unmute yourself and ask, or if you want to comment on anything, just feel free to unmute yourself.
Okay. Proceed, Samira, with the second part of the presentation.
Okay. So, can you all see my screen?
Yes, you can see.
Okay. So as part of the Mycetoma Research Club, we said that we would be discussing some funding opportunities. So today I will take you through the RSTMH grants. So my name is Samira Mohammed. I'm a Sudanese pharmacist. I'm a research assistant at the Mycetoma Research Center, and I'm also a teacher assistant at the Department of Pharmacy Practice and Clinical Pharmacy. So we will be talking about the, before I start, sorry, I declare no conflict of interest in my presentation. So we will be talking about the Royal Society of Tropical Medicine and Hygiene grants. We will be speaking just briefly about the Royal Society, the early career grants, and the travel grants or the travel scholarships. So the Royal Society of Tropical Medicine and Hygiene is a charity and a membership society. It has been dedicated to improving tropical medicine and public health since 1907, so almost more than 117 years. So through their grants program, their grants program has been established for more than 40 years. And since 2017, there has been an increase and more than 800 awards has been awarded for over 66 countries. So now we will go to the early career grants. The early career grants, they grant researchers early in their career, and it's for individuals who have not received a research grant in their own name before. And sorry, just I want to admit some people. So the award is up to 5,000 sterling, including any taxes for purchases. So the last grant opened, I think, in January, and it closed in April, last April. So then who can apply for the early career grants? Applicants from all around the world are welcome to apply, and the duration of the project should be up to 1 year. And any topic related to tropical medicine and global health from across the research spectrum. It can be lab-based, it can be clinical, just all across the research spectrum. And at least 230 grants has been awarded per year. Now pops up a question, who are early career researchers? The Royal Society of Tropical Medicine and Hygiene It does not use a definition focused on specific roles or the qualification health or the age of the researcher. And they choose to supply guidance around the profile of the suitable applicant. Now comes who are early career researchers. The applicants should be able to carry out research under supervision, have the ambition to develop knowledge of the research methodologies in the discipline, have demonstrated a good understanding of the field of study. And they demonstrate the ability to produce data under supervision, use critical analysis, and can evaluate and be able to synthesize new and complex ideas, and competently explain the outcome of the research and the value thereof to their colleagues. So this is how the Royal Society defines early career researchers. Now we move on to the travel scholarships. So the travel scholarships are aimed at individuals in tropical medicine and global health. However, early career researchers and people practicing in low and middle income countries are much preferred to get the scholarship. And they provide financial support to attend the conferences, workshops, as well as their annual meeting. And then the Royal Society has a research in progress meeting, so they fund you to attend these events. So, and here you can see this is our colleague, Rawa. Rawa is a research assistant at the Mycetoma Research Center. She won this travel grant, and she spent almost 3 weeks in London, where she attended the research in progress meeting, and it's a good opportunity for networking, for getting to know more people and listening to their advices. So here you can find resources for my presentation. And by getting to this point, I'd like to thank you all for your kind attention, and I wish you all the best with your applications. Thank you. Prof, I'm sorry, but your voice is cracking.
Can you hear me now?
Yes, it's clear now.
Thank you very much again for this presentation, Samira. Very clear, very elaborative, and it gives us a very good idea about the Royal Society of Tropical Medicine and Hygiene in London. This is one of the oldest society for tropical medicine around the globe, based in London. They have a lot of activities, meetings, and events, prizes, awards, and medals. It is very important to join this society if possible. If not, you can just ask for the newsletter. They send every month a newsletter about their activities. And in these activities, you will find a lot of scholarships, a lot of funding opportunities, and a lot of grants for young colleagues. Last year, I think I have 2 of our colleagues at the Mycetoma Center had grants from the Royal Society. And I am in direct contact with the administration of the society, and they are putting Mycetoma as an important priority in their funding activities. The important thing it is to have a proper winning proposals that can be funded by the Royal Society. It is highly competitive, but we have 2 grants last year from the society to our young colleagues at the Mycetoma Research Center. So it's always possible to get funding from this society. Thank you very much.
Thank you, Prof. If you just allowed me to add that regarding the membership, the early career grants does not require you to be a member at the Royal Society of Tropical Medicine and Hygiene, but however, the membership increases your chances of winning the grant, because some partners who fund this program, they just fund the members of the Royal Society.
Yeah, absolutely. And there is a lot of other important activities. For example, they have the Royal Society ambassadors. And again, you can apply for these ambassadors, especially for the young colleagues. And the young ambassadors, they can work with other people in their countries, trying to promote the objective of this society. And again, that will give you a higher chance to have funding from the society if you are having or holding the post of the Royal Society ambassador or champion. Thank you very much.
Thank you, Prof.
Yeah.
Yes, Dr. Ruth, yes, go ahead.
Yeah, very good to see you, Ruth.
Thank you. Hello. Thank you so much
Hello,
for
Ruth.
this. Hello, how are you?
I am fine, thank you, Ruth.
Thank you, Prof. Thank you, Samira, for that really nice presentation. I'm happy to learn that being a member to the RSTMH increases your chances. This year we tried, one of my students tried putting in a Mycetoma proposal. We were not successful, but I can see there are some other things that maybe we needed to do. And I'm happy to have attended this meeting today and learned that being a member actually increases your chances. I have one question for Samira. It was not very clear on which travel grant Rawal got to, is it to the UK, the one that you just presented? Maybe if you could expound a little bit more. Thank you so much.
Okay, thank you, Dr. Ruth. Rawa had the travel scholarship to attend the research and progress meeting, but this was a couple of years ago. It was in London. She attended the meeting, and she also, as you saw in the picture, she was presenting her work. This was a poster presented by Rawa. I hope I made it clear.
Thank you.
You're welcome. Dr. Augustine? Dr. Augustine, were you trying to say something?
No, so sorry. It is just by mistake.
Oh, it's totally fine. Prof,
Hello?
Prof. Fahal, your voice was cracking.
Hello.
Hello, Dr. Kadem. Yes,
Hello.
go ahead.
Thank you.
Hello.
I have a question for Samira. I want to know if you have the same procedure to collect a grant for Mycetoma in Sudan, all around the country, or this specific method are specific for the center or also for the MRC. Do you have a unique procedure for sampling grain in Sudan, or this procedure is just available in the MRC? Thank you.
Well, I think you were asking Nema. Nema is the one who presented about the culturing and the grains, Dr. Kadem.
Excuse me, yes.
It's totally fine. Nema, can you hear us? Nema?
Yeah.
Yes, go ahead.
Okay. Can you hear me?
Yes, Nema, we can clearly hear you. Go ahead.
Okay. Dr. Khadim, the grain collection process is the same for all grains. It is the same procedure. We take it during during the deep surgical biopsy.
Maybe, Neema, if you allow me, just to clarify the question,
Okay.
I think Dr. Kadim is asking about the collection of grains in Sudan.
Yes.
Is
Yes.
this grains is collected from different parts from Sudan, or is it only collected from the Mycetoma Research Center in Khartoum? As far as I understood.
Okay. Sorry for that.
I need
Sorry.
more explanation for the procedure, because in Senegal we don't have a procedure for the sampling of grain.
Okay. I got your point. I think there is already OCBs present in the Mycetoma Research Center, which describe in details all the steps you need for the collection of the grains. Usually the grains, as Neema mentioned, it is usually preferred to be collected during the surgical biopsy, because when you get an incisional surgical biopsy, you be sure that you are getting from the deepest part of the lesion, and the grains will be less contaminated, and it will be also viable, because the grains which usually collected in a gauze or during the dressing, which coming from the sinuses, mostly they are dead or contaminated. But anyway, whatever you are getting the grains, you need to clean the grains and wash it in antibiotic solution if you are dealing with a fungal mycetoma, of course. If you are suspecting a bacterial mycetoma, you need to just wash it in a normal saline, sterile normal saline several times, just to reduce the chance of the contamination. And this is why it's very important. Yeah.
Yes, I understand this procedure. So I want to know if this procedure is applied all around the Sudan territory.
Yes, everywhere, even if we have a mobile clinics, or if we have a clinics in different parts of Sudan, we are using the same standard procedure for grain collection.
Okay, thank you.
You're welcome.
Prof. Fahal, you were trying to say something?
No, thank you very much. No, yes, I'm enjoying the discussion about the culture technique.
Yeah, and I think everyone is good. I'm seeing some people commenting in the chat.
Yes.
I think it's very important when you deal with a mycetoma case, not only in Sudan, because in Sudan we know that the common fungal cause is Madrella mystomatis, but people dealing with patients from other parts, they need to be considering that mycetoma is sometimes considered to be like non-specific reaction to any organism inoculated to the subcutaneous tissue by any minor trauma. So you should expect any type of microorganism. It could be any fungal species, could be any bacterial species. So don't usually insist that you are going to get only Madrella mystomatis. Yes, this is the most common one, but as you see in the literature, which has been published from different parts and also from the Mycetoma Research Center, that the list of fungal causes is very big, and also the list of the bacterial causes is quite big. So you have to consider that any organism which is able to resist the immune system and get into equilibrium with the immune system and causes chronic infection can cause mycetoma. So you have to be very careful when you deal with any suspected case of mycetoma, and you should expect anything. And this is why we think that the initial examination of the grain is very crucial to help you to start the correct treatment.
Maybe, excuse me.
You're welcome.
Maybe you must specify that bacteria are filamentous bacteria. So when do you say every bacteria?
Yes, exactly.
Yeah, it's concerned only filamentous bacteria.
Yeah, I would like just to ask you a question, Mr. Kadim. You are experiencing many people that who get a minor injury, maybe on a daily basis, especially those working in a farm field. But we don't see the regular bacteria, which is normally found in the soil, and also we don't see the fungi, which is quite abundant in the environment, like Aspergillus, like for example, zygomycetes and like Penicillium. All these are found in a large quantity. Only few fungi is able to keep themselves stable against the immune system and cause the mycetoma in a very chronic way. But all other bacteria normally and other fungi is simply cleared by the immune system, and few that are able to cause the mycetoma. And this is why it's very important to don't ignore anything. And this is my point.
Yes. I agree with you. Yes.
Yeah.
Hello?
Yes, Prof, we can hear you.
Yeah, I think the first culture I ever saw was with Abdullah Osman. That was quite a long time ago. That time he was doing his master degree on mycetoma, and I learned from him how he was doing the culture that time. I have to say that the first ever test the molecular diagnosis to confirm the mycetoma was done by Abdullah Osman in the early 90s of the last century. So Abdullah is the champion of the molecular diagnosis of mycetoma. He did that as part of his PhD when he was in Rotterdam that time. So Abdullah, you should be congratulated for to be the first ever person who can using the molecular diagnosis for the diagnosis of mycetoma worldwide. Thank you very much,
Professor
Abdullah.
Fahal, I should be very proud of being your student, and all the work has been done under your careful supervision. And you are the person who actually helped many people to do and make many achievements in mycetoma. Thank you very much, Professor Fahal.
Congratulations.
Welcome, Abdullah.
Congratulations, Dr. Abdullah. Actually, it's the first time for me to know this, that you were the first one.
Yeah.
So I see someone in the chat saying that the meeting is quite interesting, and next time they'll come prepared for the deep discussion and participation. So I'm just replying to this person that you have to. And if there's any more questions?
We have now two groups from sorry.
Yes, Prof, go ahead. There are no questions.
Yeah, we have two colleagues, one from Kenya and one from Senegal, and I would like them to present their experience on mycetoma in this meeting. Ross, I am sure that you're going to talk to us nicely about mycetoma in Kenya, and I know you was in a field trip a few weeks ago in an area where mycetoma is endemic, and I will be very grateful if you can give us your experience on this. And Kadim, again from Senegal, I'm sure that you are going to give us your experience on mycetoma. And you are dealing with a good number of patients with mycetoma there, especially lactama mycetoma, which is a very common problem in Senegal.
So we would be happy if...
Hello?
Yes, Prof, your voice is clear.
Yeah, that is okay.
So of course we'll be interested if Dr. Kadem, of our colleagues from Senegal and Kenya joined us and to share their experiences.
Thank
Yeah,
you,
and
Prof.
also, yeah.
It will be a pleasure to share our experience from Senegal in this club. Thank you for the invitation. We will share our experience and practice in Senegal next.
Okay.
Thank you. Thank you, Prof, for that invitation. We'll share next time. Thank you so much.
Okay, fine. Professor
see.
Limia, any comment?
And if you allow me, Professor Fahal, and I'm also inviting all members of the research club to share with us their experiences. It's not only about the senior staff. We are looking also for the junior students. If they have any early research, if you have any problem in their research, and they would like to have any questions to be answered, please go ahead and ask for the presentation. We will be very happy to hear from you.
Yes, of course, Dr. Abdullah. I see Olga has a raised hand, and Dr. Augustine also had a raised hand. Dr. Augustine,
Yes. Okay.
Yes,
I
please.
have to thank all of you because this discussion was very, very high level and good for newcoming and for all researchers. But as Professor Fal can certify it, me as Afro focal point, I have to encourage all of you and essentially to push you to be sharing your information with the national program at the Ministry of Health. And even when you are looking at money found for research, please, if it is possible, to mobilize money for sensitization, because many African countries need sensitization and epidemiologic mapping of Mycetoma. They are not, you can see there are not many countries where they are research and or really the mapping is known, and we need to push many countries to map about Mycetoma and to be sensitized to be to start working on Mycetoma. For me, I'm pushing after your research. We need to push in the epidemiological aspect and sensitization tools for the other country in Africa. Over to you.
Thank you.
Yeah, Samira, yes.
Yes, Prof, I can hear you.
I would like to let you know, during the last 2 weeks, we had 2 papers published on mycetoma from the Mycetoma Research Center. The first was on the clinical trial that started in 2017 and finished in 2022. And we have published our experience with this first ever double-blind clinical trial, published in the Lancet Infectious Diseases. I hope that you can have the time to see that paper. Again, last week we published another paper on the Mycetoma Research Center, community engagement activities and initiatives. And again, this is a good paper where all our activities at the level of the community stated are reported in that paper. Samira, can you share these 2 articles for the group, please?
Yes, I will do immediately after we finish. I'll share these two papers. Olga? Yes.
Greetings to everyone. Thank you for the invite. Also, it was a very interesting presentation, especially in the selection of fungal, analytical bias fungal disability, and also it's very for the invitation for us to present our work.
Excuse me, Olga, but can you raise your voice?
You can't hear me. Can you hear me now?
Yes, now it's clear. Go ahead.
Okay. I'll repeat. I'm saying it was a very interesting presentation, especially in the isolation methods of the fungal aspect. I'm a little bit biased on the fungal aspects of elements of Mycetoma grains, which are causing problems in Africa. That was a very good presentation. And also, I would like to offer congratulations to the person who had done the molecular bit. I think that's also another place where we really need to look at. And also we'd like to thank Professor Fahal for inviting the Kenyan team for the presentation, which I think together with Ruth we'll be able to present a good work on that. Thank you for the invite. Thank you.
Thank you, Olga. So I just want to say, as Dr. Abdullah said, that the floor is open for anyone who would like to present their work, whether it's Mycetoma or not. So you can just email us at researchclub@mycetoma.edu.sd. I've posted that in the chat. And for those who didn't, who still didn't join the WhatsApp group, I'll just put my WhatsApp number and then you can contact me and I'll add you to the WhatsApp group, because I see that other members are sharing some funding opportunities, funding opportunities and research opportunities. So I think it's better to join the WhatsApp group.
Yeah. One comment, Samira. Hello.
Yes, Prof. We can hear you. Go
Yeah.
ahead.
Yeah. For more information about these culture technique and other techniques, please visit the Mycetoma Research Center under the research, MRC research publications. There's a page on SOPs, and on these SOPs you find many of these laboratory techniques available there. It will be very helpful for you to go and see this. And we have another training module, that is the module on the mycetoma diagnosis. And in this module, it is a Moodle based module where all the techniques to diagnose mycetoma is available there. So I really would like to invite you to go and see these two websites where more information about the laboratory diagnosis of mycetoma is available, and it can help us a lot, especially our young colleagues, to establish the local mycetoma diagnosis labs and facilities. Emira, please share with us these two websites for the group to see them.
Okay, I already shared the link to the SOPs, and for the publications, I'll be sharing them after the meeting.
Okay,
Yeah,
and for the training module, please, training module, online training module.
Okay, I'll share it now.
And also, Professor Fahal, I think the WhatsApp group will serve very well for making some networking between the members. So if anyone have any issue, he can just write it down in the WhatsApp group, and definitely he will find someone to help him. So if you have any research issue, any issue about the techniques, or you have a research problem in your methodology, if you have facing any problem, just write it down in the WhatsApp group and you'll find someone to support you.
Thank you. This is very kind of you, Abdul.
I see that Nadir has a raised hand. Nadir, you can unmute yourself.
Hello, do you hear me?
Nadir. Yes, we can hear you.
Thank you very much. Dr. Nadir Musa Khalil of Zaid, Associated Professor in Medical Microbiology, and first consultant also of Medical Microbiology in Durman Islamic University. Really, I am very sorry. We are close from Sudan, and I have a weekend that we have not good stability for the internet. So really, I missed the presentation which we have introduced. But my questions about the cancer technique, because I have master student working also for isolations of mycetoma, and our hypothesis about this thing really about what have done Prof. Abdullah Usman about induce from soil.
Nadir, we missed your voice. We're missing your voice.
Samira Alekallah, share with the group the site for the presentation, this presentation and the previous presentation as well. So people that can go and see the videos about this Mycetoma Research Club.
Okay, for sure, Prof. For sure, we'll be sharing them. So, Nadir, if you're here. I think we missed Nadir. So, does anyone has a question before we wrap up? Okay, Prof, would you like to say something before we end the meeting? I see that
no, I would like just to thank everybody. I would like to thank everybody for his or her time to attend this meeting. and for sharing experience, and looking forward for really a good collaboration and supporting our young colleagues to obtain their degrees, experience, and the research. Thank you very much.
Thank you, Prof. Dr. Abdullah, would you like to add anything or a comment? So I think we shall end for now. Thank you all we're glad to have you all here today, and thank you for your kind attendance. And we're looking forward to having you in our upcoming meetings. And I think Dr. Kadim will be joining us next week, talking about mycetoma in Senegal. So we just see their experience in Senegal. And thank you so much and have a nice day. Goodbye.
Bye.
Thank you. Bye.
Bye.
Goodbye and thank you.
Thank you, Nema. Thank you.
Thank you.
Thank you. Thank you. Thank you. Have a wonderful day.
Thank you.